Welcome to the Empowered Women Life Leaders podcast. I'm your host, Karen Bashford. This podcast is for every woman who has ever felt limited by her past, silenced by trauma, or held back by society's expectations. Each week, we will share powerful stories, expert insights, and practical tools to help you become the leader of your own life. With me today is Thomas George, PhD. And he's involved in something called Medivault. I met Thomas when I went to the Global Women's Conference last month, actually, in July. And I happened to sit next to him and we got talking. And what he shared fascinated me. And you know what I like? I like fascination. I like things to be different. So I invited Thomas onto this podcast with you. And all I can tell you is he is a gentleman that is creating something that can change your health and prevent illness. That's all I'm going to say, because now, Thomas, welcome. Please introduce yourself and just share a little about how you become involved, because as I said earlier, I want you to spend as much time explaining what's involved as possible.
Sure.
So please go ahead.
Oh, thank you, Karen. Thank you so much for inviting me on. And it was a pleasure meeting you a few weeks back as well. Yeah, we had a great chat at the conference and really hit it off. And I think hopefully your listeners are going to really be interested by what we're doing. So actually, the latest project I'm working on is called Freya Health. So you can find this at freyahealth.com. That's FREYR health.com. And well, what we're doing is actually developing a platform for patients to aggregate all of their health data from any source into one place. So you can take your records from your local healthcare system, like the NHS, also any private clinics that you go to, any monitoring devices that you use in the home, also wearable technology, so like your Apple Watch or your Fitbit or Oura Ring, any of these. And so any health data that you have alongside kind of your genomic data, so genetics as well, and any personal reported data, this is all really valuable health information that doesn't always get aggregated into one place for a patient. So it's kind of in siloed areas around the world. It might be with the NHS in one instance, but then also with Fitbit in America at one instance. So they never kind of meet each other really. So we've developed a platform that allows you as a patient to aggregate it all into one place and get insights from that data in terms of your risk for disease, and also tells you how to optimize your health relating to those risks. But then the additional thing we do is allow you to travel with your data globally and then also share it really securely with trusted third parties. So if you were to travel to Sicily, like the holiday you've just been on, and you had a health issue in Palermo, you could go to your local clinic in Palermo and immediately give them access to your entire medical record so they could give you the best possible care there. And so then they're not waiting for the NHS to respond to give you your data and your details. You can immediately have all your details there for the doctor so that they can treat you and give you the best care possible. Then whatever care that they've given you there, you can also add to your record to take it back with you to the UK or to your home country, so that then you've got a full record of what happened when you're on holiday and add it to your record in the UK. So that if there's any complications when you get back, your doctor's fully aware of everything that's happened to you. So the additional point that we can do as well is be able to share with trusted parties like pharma companies and insurers, so that actually we can add a fuller data set to the pool of data that's available for research. And you as a patient can control who gets access to your data. So if you want to, and there's a study that Pfizer are running, a big pharma company, that relates to you specifically, you can choose to opt into that study and then get rewarded for sharing your data with these pharma companies. Because currently, what's happening in the world is all these pharma companies are using your data by accessing it through the NHS and through your private health providers without your knowledge, really. So whenever you sign up to a procedure, you'll kind of allow the NHS to use your data for research, but you've got no idea what they're doing with that data. But then a Pfizer or a pharma company will buy that data from the NHS and use your data without your knowledge, really, and add it to their studies. But you get nothing for this, and you don't even know it's happening. So what we want to do is like empower patients to do what they want with their data and actually get rewarded for it. So a little bit on my background as well. So I've got a PhD in aging and longevity. I got this in 2009, and I've been involved with a number of healthcare companies setting up different digital health companies over the last 15 years. So the first one I set up was looking at aging and longevity, where I was one of the first people to like map your aging process and tell you the rate of aging that your body was going through, and give you a report to show exactly the areas you can focus on to improve your aging process, and then also show how this was affecting you physiologically through different physical tests, and show how any interventions that we were making on your aging process could improve that uh, rate of decline in your aging. So that was my first business. And then I've also been involved with a number of global healthcare companies looking at cancer care, trying to optimize that with diet and lifestyle so that it complements any cancer treatments and you're getting the most from your treatments without any side effects or reducing the side effects. Then another company I was involved with was a remote monitoring company out of Singapore. So we were working very closely with some large tech companies like Google and Fitbit, and also some huge, healthcare companies across the world in Africa, the Middle East, India, Singapore, and America. And what we developed there was a platform that allows you to monitor patients outside of the clinic. So when you go and see your doctor, they give you a care plan on how you can improve. But most people, they'll follow this care plan with what they remember from their clinic experience for maybe a few weeks after they've left the doctor's surgery. They might continue taking their medications correctly for a little while longer, but often things slip in their care process. So what we developed was a platform that allows you to monitor what you were doing outside the clinic to identify if you were trending in the wrong direction, and then give you nudges and reminders at the right times to keep you on track. And if you were slipping too far as well, we could alert your doctor at an early stage to get you back in and modify your care plan so that you can remain on the right course with your treatments. And then so from doing all this global work, so sorry, I've been talking a lot, Karen. You can jump in a second. From doing all this global work in healthcare, one of the key things that I noticed was that data is fragmented and siloed everywhere in the world. So if you're a patient that wants to get the best care, you need to yourself be aware of all the different tests and things you've gone through, all the different places you've been to where you've had doctors see you. And it was down to kind of the patient to really be on top of what their care process was, all their diagnoses, all the treatments that they've had in different places globally. And this wasn't readily available to a doctor whenever you went to see them. And it was down to the patient to remember everything and get it right, and remember exactly what diseases they had, exactly what medications they were on, everything. And what we wanted to do was help patients aggregate all this data into one place so it becomes more seamless for both them and for their doctors, and they can get the best care possible.
Wow, that's a lot. Okay, let me put my questions together then, because there's definitely something you said when you first started speaking. I am assuming that the way the data is collated and information is all pulled together, it doesn't matter where in the world you are, you can access that information. Is that correct?
That's correct. So we're designing it. We've designed the platform so that it complies with the highest levels of data security and all the kind of HIPAA and GDPR standards for data. So these are the levels of data security and compliance that we have to adhere to in Europe and the UK and also in the States. And this is what countries globally kind of follow in terms of data compliance and security. But whenever you capture data, it needs to be stored in the hospital group or the kind of or a kind of data silo and in cloud in the country of origin of that data. So if you, Karen, you have your data in the UK, and if you did happen to go to a clinic in Sicily where you were recently, your data would have to be stored both in the UK and in Sicily. And then if you wanted to aggregate all your data, you would need a method that allows you to then capture that data from both places and push it into one place so that you could view it all. And this is what we've created. So when you have your Freya Health app, it identifies through a token that you have, a secure token, where your data points are all located. And this is all anonymized and secure and at the highest levels of security. But then we can identify that maybe you have 70 data points from Sicily and 100,000 data points from the UK that's being stored in the NHS. And we can then aggregate these data points together, put them into a longitudinal timeline, and display them in a way that allows you to see your longitudinal health data on your app. So we stream that data from its point of origin onto your app so you can view it all, and then you can also choose to share it and do whatever you wish with that data. But the data is always maintained in its area of sovereignty and security in the location where it was originally captured.
So you've answered the question that I was going to ask, because it was concerning me if you were going to pull data from all over the place, what would then happen to that data if it all come into a central point that only I had access to? So yeah, you've answered my question with regards to that. What happens then? Obviously, say in Sicily, they would have written it in Italian. I'm UK. I've been to other countries where they've got their own languages. So how does that all come together so it's readable for me or for anyone that has to have access to it? Is that naturally translated?
Yeah, so this is one of the elements that we've put into the platform. So whenever you capture data from different sources, it may be in different formats, it may be in different languages. You might have some data that's digitized and part of your electronic health record, and some data that's on a piece of paper essentially, and that we need to extract data from. So when we're working with countries like Africa, where we're rolling out at the moment into Ghana, half the records are digitized, half are actually on paper. So we need to extract the paper records by taking a photo of them and then using a AI and optical character recognition system that we're developing to take the individual data points out, recognize what language they're in, translate that language, also recognize what data point refers to a blood pressure reading, what data point refers to a cholesterol reading. So we can identify exactly which data points are where, and then we sort and normalize these data points and put them into a database that then fits back in with the standard for medical data that's used globally. So there are various standards that we comply to here, and it's a little bit technical jargon, but there's kind of the main standard that's like the top standard at the moment is called FHIR, FIHR. But then there's also SOC 2 and HL7 that are applied to different healthcare groups globally. And all this means is that there's like a database that you need to fit the data in so that when you're sharing it with a hospital group or a pharma company, it fits with their method of data extraction. So what we do when we take data from different sources is we have this method of sorting and storing that data that then allows it to comply with these international standards so that it can be shared globally.
So technically, listening to what you're sharing, this A will speed up any visits you happen to have with the medical profession, if you're, say, if you're in a car accident or anything like that, they haven't got to worry about how they access that information because it's already available yourself to be able to say, yeah, I want to release this information. So my one concern, I think, would probably be, what's the word I want? Is all in spread around, but within the app itself, you have access to it. How do you manage that within the app as the person who's got access to that app? How would I manage that then?
Right, so within the app, when you sign in, you have to verify who you are. So you go through a verification process with your ID, and that this links back into your care provider ID as well. So wherever you get your data from, we need to verify that that data is linked with your personal ID. So with
Okay.
it with every source, so with the NHS, you'll have your NHS number. If you integrated with a different clinic, they'll have a different ID number for you as well. But we need to verify that those ID numbers are associated with your data and they all fit back in with your own personal profile. So that's the first thing. So then when you aggregate all the data together, there's a screen that you can access on the app and on the dashboard that gives you all the parameters that you're capturing within the system. So if you're looking at blood pressure, for instance, it will have all your blood pressure readings from when you started measuring it up until today, and then it will show you a longitudinal timeline with the trends in those data readings. We also use AI to generate a summary of your complete medical record. So it will go through all of your medical records, all your data. It will identify if there's any conditions that you're suffering with, any medications you're on, and the latest readings in your data, and also your trends. And these will then be displayed in a summary screen that you can share. Either you can just view yourself to get an immediate overview of your health, or you can share immediately with a healthcare provider, and then in a number of seconds they'll have the general readings about you that are going to be used for your diagnosis and your care.
So would that help, say, for like insurance purposes? Because obviously I've had to take insurance out to go over to Sicily. I don't have any medical insurance, but the more information you can give a medical insurance company, I assume either the more expensive or the cheaper it becomes because they've got your true history.
Yes.
So is that going to help somebody then to be able to get better medical cover?
Well, it should do. I think the whole insurance industry is a little bit backward at the moment in terms of the way
Mm,
that they treat people with diseases.
hmm.
So, and we're trying to come in at the kind of reinsurer level to try and get a kind of filter down effect with how people utilize medical data in insurance. So we allow patients to share data with insurers if they want to. It's down to the patient themselves. But
Yeah.
then uh, what insurers do at the moment is they'll kind of, if you say had diabetes, they would label you with a diabetes
Hmm.
tag. And even if you're keeping to the best possible diet and lifestyle and are never going to have any issues relating to your diabetes, your premiums will still be pretty much the same as someone who's like eating McDonald's every day and drinking loads of Lucozade. So
Yeah.
it's kind of yeah, it's a bit of a problem in the insurance industry, the way they treat
Mm.
people with disease and how they actually adjust their premiums based on different diseases, even if people are being fully adherent to a care plan that their doctors set and have no real chance of any complications because of that. So what we're trying to do, and there's a big movement on this at the moment, but it's moving quite slowly,
Mm.
is to try and um, allow insurers to adjust their premiums based on your diet and lifestyle and how compliant you're being with a condition. And we're working with a company in the UK at the moment that's offering a specific diabetes related insurance that relates to whether you're complying with your care plans or not. So if you're not complying, you can still apply to this insurer, but it will give you a premium that's kind of in line with what the other insurers will
Mm.
provide. But if you are complying, your premiums drop to like near to normal levels of insurance coverage in terms of cost, because you can show through your longitudinal monitoring, through using wearables, through going and seeing your healthcare practitioner and testing your HbA1c constantly on your glucose levels, and getting that kind of stamp of approval from your doctor that you're complying with the care plans that they've set. And if that's the case, your premium should be a lot lower than someone who's not complying with the suggestions from the doctors given for diabetes.
That's fascinating because when I applied for my insurance for the travel, I had to answer medical questions. And one of the things I've had was acute pancreatitis, which obviously relates mostly to gallbladder.
Yeah,
I was penalised, and yet that was over 5 years ago, and I've not been back for any issues at all. And yet, to me, that sounds stupid because 5 years down the line, I'm not having any issues, but they're still penalising me for it. So I suppose in some ways, if what you're doing then allows you to give permission for pharmaceutical companies to be able to access and do research based on genuine results that have been collated together, that is obviously going to have an impact in the future, perhaps not very soon, but definitely in the future, that will allow a more realistic outcome prediction.
yes,
So, in turn, it then helps insurance companies make better decisions. But also, for me, from what it sounds like, it also allows, like, I won't need to declare that I've had pancreatitis because I'm no longer showing any of the symptoms and have
yeah,
proven through time that it's no longer relevant. So that is obviously going to be of benefit to anyone who uses your app.
yeah, absolutely, absolutely. So the one of the other elements to the app I mentioned about the data sharing and
Mm-hmm.
data aggregation. So we're looking to uh, create a data lake essentially from all the people that we onboard onto the app, and we're initially focused on underserved populations globally. So we're rolling out across Africa initially. We're in the process of signing a deal with the Pan-African Parliament to get access to all 55 member states' medical records. And we're starting with Ghana to roll out our app there, extract as many medical records as possible, help with the engagement with healthcare out there as well. And then if these patients then want to sell their data or use their data as part of the data lake, it all gets added to this large wealth of data that can be accessed by pharma companies and by research organizations and healthcare companies. But these companies then pay us a subscription to use a model of access to the data that allows them to query the data without any of the personally identifiable information or even the data itself being shared with the companies. So they can ask a question and get a response from our large data set without any of your data being personally shared. So, as an example of this, if a pharma company, say AstraZeneca, was doing a um, trial on cardiovascular disease, and they wanted to see how many patients in Ghana were at risk for cardiovascular disease and were also between the ages of like 40 and 50 and were female. So they could then query the data set and identify that there were 50,000 patients that fit the criteria. They wouldn't know anything about these patients. They wouldn't have shared any of that data with their patients' data with the pharma company at all. But these patients can then get notified that, oh, you may be eligible for a study with AstraZeneca, and they can get notification through our app. The patient can then decide, oh, do I want to opt in or not? If they choose to opt in, immediately they can join part of the study and start sharing their data, but they can also get a monetary reward for sharing that data immediately as well from AstraZeneca. So this helps AstraZeneca because it's identifying patients for a study more accurately and quickly than they can do
Mm.
currently. And also they put in so much money into patient recruitment at the moment, and often the patient recruitment isn't quite as accurate as they need to, so they identify patients that they have to then disqualify after the fact. So initially the patient recruitment is better for them, and then also they get access to data sets that they're not normally going to get access to. So in going into places like Africa and Ghana, we can provide a wealth of data that's adding to these data lakes globally that's not normally able to be accessed by these pharma companies. So this allows them to train their AI models better on a more global data set, also to identify new population groups that they can repurpose existing drugs for and save them a lot of money and potentially get a lot of profit in that way. And for the patient, they get monetary reward for sharing their data. So they essentially will be providing a universal basic income relating to your health data sharing. Also, we want to encourage patients to engage more with healthcare in these underserved populations. And the more we can show that when they aggregate more and more data in their record, it becomes worth more and people and more pharma companies will want to buy it, the more patients are going to engage and come back to their doctor more frequently and also adhere to their care plans and monitor themselves outside of the clinic so that their data sets are more rich and valued by these pharma companies, and then they can continue to be getting that universal income in response to their data sharing.
Okay. So we're nearly out of time. Well, we are technically out of time because I try and keep it to 30 minutes. So a quick question. Is there a cost to the person to access that information themselves?
No. So
Wow, really?
so we want to give this app away for free. Um,
Wow.
there'll be certain modules that we add to the app that you may have to pay a subscription for, and it may only be for kind of a short amount of time. So, as an example in this, we have a face scan technology that we've integrated with the app that allows you to monitor your blood pressure, your HbA1c levels for your diabetes, your breathing rate, your stress levels. And this is from a 30-second face scan that you can just hold your phone in front of your face. And
Wow.
so we want to integrate this for free as much as possible. But then there's other elements that we have, like a wound scanning technology that allows you to be discharged earlier from hospital and heal your wounds in your home instead. So we can take photographs of your wound as it's healing and then use AI to determine if your wound's getting infected, if it's healing at the right rate, pass this information back to your doctor so that they can assess remotely if you're healing correctly and see exactly when they need to get you back in if you're not healing correctly. So
Wow.
that kind of thing would require an additional subscription. But
Understandable.
um, the the revenue from this is going to come from the data sales themselves and from the subscription from the pharma companies to access that data. So so essentially, when a pharma company contacts you to share your data, if you then opt in, we'll take a cut of the data, the money that the farmer's going to be passing on to you in terms of the money for your data. We'll take a cut of that to fund the app. You'll get the rest. Well, or actually, you'll share the rest with either yourself or with any healthcare providers and other parties that have helped to aggregate your data. So in Ghana, for instance, because half the records are not digitized, whenever there's a data sale, we're going to be rewarding the people that have helped to digitize that data by taking the photos of the physical records and allowing our platform to then digitize it and put it into the digital form. So we want to essentially help everyone at each level of the supply chain here and give our app away for free to as many people as possible so that we can start aggregating data and allowing them to get the most from it.
You have really surprised me because I was seriously expecting to be told there was a fee for this. So absolutely brilliant as far as I'm concerned.
Oh, fantastic.
Tell me again, how do we access this app or information that will be available for people to do so in the future?
So if you go to freyahealth.com, that's our website. We'll be launching towards the end of this year. So I'd be very happy to get any feedback from your listeners, and if they want to contact us to see how they can get onto the early waiting list to get access, we'd be very happy to put them on there. So it's FREYR health.com.
Well, I will be sharing that with the notes that go out with the actual recording. But thank you, Thomas. That has been so insightful, and I'm sure that once it goes live, there'll be so many benefits for medical profession, farmers, and actually the individuals. So thank you for your time. Really enjoyed speaking with you. And
Thank you, Karen. Really appreciate it.
yeah, and let's stay in touch. I'd love to be able to have you come back once you've got some data together with people actually involved in it and hear more about it and the impact it will be having. So
Oh,
thank
it'd
you.
be my pleasure to come back. Thank
Thank
you.
you.